Hi, my name is Gabriela Luzuriaga Maldonado, and now I'm going to talk about urinary tract infections in older men. Like definition, a urinary tract infection is an infection that occurs anywhere in the urinary system: the kidneys, ureters, bladder, and urethra. Most infections occur in the lower urinary tract, the bladder and urethra. Urinary tract infection usually occur when bacteria enter the urinary tract through the urethra and begin to multiply in the bladder.
Hello. Today we are going to answer some frequently asked questions about urinary tract infections, or UTIs. UTIs cause more than 8 million visits to healthcare providers each year. About 1 in 2 women and 3 in 25 men will have symptoms of at least one UTI in their lifetime. What is a UTI? A urinary tract infection happens when bacteria grows in your urinary tract, which includes your kidneys, bladder, and urethra. Bacteria may get into the urine from the urethra and travel into the bladder. They may even travel up to the kidney, but no matter how far they go, bacteria in the urinary tract can cause problems. What are the symptoms of a UTI? Symptoms of a UTI are different for everyone, but can include burning or pain with urination, frequent urination, lower back pain, cloudy or smelly urine, pelvic pain or pressure, and fever. And symptoms vary depending on what part of the urinary tract is infected. If the infection is in your kidneys, you may experience upper back or side pain, high fever, shaking and chills, nausea, or vomiting. If it's in your bladder, you may feel pelvic pressure, lower abdominal discomfort, frequent painful urination, or blood in urine. If the infection is in your urethra, you may have burning with urination, discharge, and post-void urethral discomfort. Why are UTIs more common in women? Just as some people are more prone to colds, some people are more prone to UTIs. UTIs are more common in women because they have unique risk factors, like having a shorter urethra than men, so bacteria has a shorter distance to travel to reach the bladder. And certain birth control methods that women may use, and menopause, can also cause UTIs in women. Also, women are more prone to lower urinary tract infections due to anatomical differences, because the rectal area, which can be a reservoir for bacteria, is in close proximity to the vaginal urethra area. How are UTIs treated? A UTI can usually be treated with a short course of antibiotics. Pain and the urge to urinate often go away after a few doses, but it is very important that you still take the full course of medicine even if you feel better. Unless UTIs are fully treated, they can often return. How can I prevent UTIs? There are a few steps you can take to avoid getting urinary tract infections. Drink plenty of liquids, especially water. Empty your bladder soon after intercourse. Don't hold your urine for too long. And for women, avoid potentially irritating feminine products. Wipe from front to back. Choose a different contraception method because diaphragms and spermicide can lead to more UTIs. So there you have it, all of the basic information about urinary tract infections. If you have more questions about UTIs, visit our website at urologyhealth.org. And if you think you may have a UTI, call your doctor right away, because if left untreated, UTIs can become serious.
Applications in medicine. The signs and symptoms of a bladder infection in men include the following: frequent urination, intense and persistent need to urinate, burning or tingling sensation while urinating or immediately after urinating, blood in the urine, and cloudy urine with a strong smell. The antimicrobial of choice is cotrimoxazole. Fluoroquinolones are effective in treating cystitis and can be used both a single dose and as a 3-day regimen. and the option fosfomycin trometamol is also useful in uncomplicated cystitis in the elderly.
From NIHSeniorHealth.gov, built with you in mind.
The most common type of bladder problems that affect older adults are the need to urinate frequently daytime and nighttime, rushing to the bathroom, having wetting accidents or urinary incontinence, trouble urinating, dribbling after urinating, and bladder or urinary tract infections. There are two main types of wetting accidents. The first type is urgency incontinence, when you simply can't make it to the bathroom in time, and the second is stress urinary incontinence, where you might lose urine in response to a physical activity such as coughing, sneezing, bending, or lifting, and even moving from a sitting to a standing position or walking can cause leakage in some people. The signs of bladder problems can be needing to urinate frequently, trouble going to the bathroom, burning or discomfort before, during, and after urination, or seeing blood in the urine, which could be a pinkish tinge or it could be bright red. Bladder problems are pretty much the same for men and women. However, what causes the problems can be quite different. Men, for example, have a prostate gland. The prostate gland tends to get larger as men get older, and it blocks the flow of urine. And this is what causes the difficulty urinating. Women don't have a prostate gland. However, what's unique to women is the fact that in order for their anatomy to accommodate giving birth, their tissues have to stretch. And as a result of that, there can be nerve and muscle damage that can contribute to urinary incontinence and other symptoms. The incontinence may actually not happen for a number of years after childbirth. So incontinence is more common in women than it is in men.
About pros and cons. Most UTIs can be cured. The symptoms of a bladder infection in most cases disappear within 24 to 48 hours after treatment begins. If has a kidney infection, it may take 1 week for their symptoms to go away.
UTI stands for urinary tract infection. It tends to incorporate a number of different entities to include kidney infections, bladder infections, prostate infections. Those can be given other names, but they all have in common typically bacterial infection of the urinary tract. In men, urinary tract infections typically show up as prostatitis. That is, they feel they have to go to the bathroom more often, they're frequently voiding in small amounts. Sometimes they have to push to enable their bladder to get the urine past a swollen and therefore enlarged prostate gland. Sometimes there will be blood associated with that, usually not, but sometimes there can be. Prostatitis in men should be treated initially with a month-long course of antibiotic therapy. The month-long course minimizes the risk of recurrence in the next 6 to 12 months. Urinary tract infections in men, the vast majority of the time, are of unknown cause. Urinary tract infection is not a sexually transmitted disease in either men or women. Urinary tract infections in women are far more common than they are in men, and have far greater not only prevalence but recurrence rates in women as well. There are a number of things that women can do to avoid urinary tract infections. 4 things that I always cover with women. Number 1 is after they go to the bathroom, they should wipe from front to back, not back to front, because that brings contaminants, normal bacterial flora from the vagina onto the urethra, which can put them at risk for infection. Second is their underclothes should be cotton through the crotch area. Third, they should empty their bladder shortly after sex, certainly before going to sleep for the night. And some women are set up for urinary tract infections if they take baths, particularly with additives in the water, compared to taking showers. That said, there are some women who just are prone to urinary tract infections. And there are a number of ways to handle those. For an isolated infection or two every year, routine antibiotics when you have symptoms are most appropriate. Some women require suppressive antibiotics for 3 months or more at a time, where they take an antibiotic pill each night before bedtime in order to establish a sterilized bladder that does not have any bacteria, and then they go on from there to have a more normal pattern without recurring infections. A few other things to note about urinary tract infections in women particularly is they can progress to what's called pyelonephritis, or kidney infection, with some speed. Bladder infections tend to present lower tract irritative symptoms, burning with urination, going frequently, small volumes with each urination. Kidney infections are typically distinguished with the hallmark fever, chills, and flank pain. That presents a greater challenge. It's a more serious illness and needs prompter attention than a nuisance type of urinary tract infection affecting only the bladder. Additionally, bladder infection can also show up with hematuria, that is blood in the urine, that can be seen, usually caused by the infection, but sorting out whether it's caused by the infection or some other cause is the job of a urologist.
Issue applied in Ecuador. Urinary infection is a problem that is frequently seen in the elderly, where the incidence reaches up to 50%. This higher incidence of UTI in the elderly has several reasons. In the case of men over the age of 50, the appearance of prostatic adenoma causes a low obstructive uropathy. The incidence of asymptomatic bacteriuria increases with age and is more common in the elderly with functional limitations. It appears in approximately 35% of institutionalized elderly without urinary catheters and in 100% of catheterized patients.
Hi, my name is Katie Brosnan. I'm a registered nurse here in Austin, Texas, and today I'm going to tell you about urinary tract infections in men. The flow of urine is nature's way of eliminating water, fluid from our system. It's eliminating, but it's also preventing and helping to flush out any sort of bacteria. Sometimes there's a breakdown in the system, and E. coli, which is in our colon, is the most common culprit for causing a bacteria that causes urinary tract infections. And somehow this makes its way up the urethra and into the bladder, causing the infection. A lot of the things that could bring this on, there's a couple of things. One of them is blockage, which could be from kidney stones or an enlarged prostate. Another is having a catheter inserted, and that's kind of like a little highway up into your bladder. Some of the signs and symptoms of a urinary tract infection or a UTI are pain or burning with urination. You might have fever, there might be a foul smell in your urine, you might have the need to go frequently, but when you go, not a whole lot comes out. Cloudy urine, or some pain in the back, which is where our kidneys are. So this is easily treated with antibiotics. You go to the doctors, they'll take a culture, they'll find out what bacteria has actually gotten into your bladder, and then from there they'll determine what antibiotic is the best for that bacteria. And that is a little bit about urinary tract infections in men.
And finally, the conclusion: infectious diseases are one of the main causes of mortality in nursing homes and one of the main reasons for hospitalization. Specifically, urinary infections are extremely frequent in institutionalized elderly, although most urinary tract infections are asymptomatic. Episodes of symptomatic infections contribute to morbidity in this population.
From NIHSeniorHealth.gov, built with you in mind.
There are many things that you can do to keep your bladder healthy. First of all, just going to the bathroom to urinate on a regular basis, at least every 2 to 3 hours during the day, is important, even if you don't really feel the urge to go. In addition, make sure you take time to relax so that you can adequately empty your bladder. For women, it's really important to sit down on the toilet seat. Hovering over the toilet does not allow your pelvic floor muscles to relax completely and can maintain urine in your bladder, which can then contribute to having to go back and go to the bathroom more frequently, or potentially contribute to getting a bladder infection because the bacteria has a chance to build up in the bladder. It's also important to avoid restricting your fluids in an attempt to minimize your bladder symptoms. When you restrict your fluids, you can get dehydrated. And older people, when they get dehydrated, are particularly prone to getting lightheaded when they go from sitting to standing or from lying to standing. And once you get lightheaded, then you oftentimes have to sit back down again. In that process, you're taking much more time to get to the bathroom than if you maintained a good state of hydration so that you didn't have to worry about getting lightheaded. In addition, when your fluids are restricted, you're much more prone to constipation.
Staying hydrated and preventing dehydration is important. However, a lot of patients come to us ingesting large quantities of fluid because they're under the assumption that drinking lots of water is important and healthy. It's actually not recommended to drink large quantities of fluid. You should really just drink when you're thirsty, and drinking water instead of coffee, tea, or soda is preferred. As far as overactive bladder, there are a lot of behavior modifications that patients can make that can help prevent urgency, frequency, and getting up at night or nocturia. Those include limiting your intake of bladder irritants like coffee, tea, soda, alcohol, anything caffeinated, anything carbonated, anything very spicy or acidic. Just by making some small changes to your diet, you can make a big difference in your urinary symptoms.
A high-fiber diet is so important to maintaining good bowel function, and constipation contributes to bladder symptoms. It's really important to do everything possible through a high-fiber diet to keep your bowels moving regularly. Something else that's really important is to not smoke. Cigarette smoking has been associated with bladder cancer, and when you smoke, your lungs are irritated, and that can cause you to cough, and the coughing can contribute to urinary incontinence. Staying active prevents weight gain and helps you maintain your overall musculoskeletal strength so that you can move quickly to the bathroom when you need to.
Thank you.